Okay, I want to say good evening to everyone that is joining us. Okay, you're welcome to Kidney Health Class. I'm Honorable Victory, your kidney health coach. And today we'll be looking at something very, very important. In fact, I'm so excited about this topic we're going to be talking about today because a lot of things actually depends on it. Okay, how healthy and how long we are going to live on this earth has a lot to do with what we are going to be discussing today. Okay, all of us should know why we are here. We are here because we want to learn how to reduce high cholesterol. Okay, if you're here and you're having high cholesterol, or you know someone who has high cholesterol, this is the best place where you can actually get real-time solution of what you can actually do to be able to bring down your cholesterol level. I'm Honorable Victory and I'm your kidney health coach. So you'll be saying that how will a kidney health coach be talking about high cholesterol? The reason why I'm talking about high cholesterol is that high cholesterol is a contributing factor to high blood pressure, and high blood pressure is the leading cause of kidney failure. So I discovered that if we can actually fight high cholesterol, we will be able to reduce um, high blood pressure, which is actually a causative disease or sickness that actually leads to kidney failure. Okay, so having said that at the background, just trying to introduce myself, I want us to go direct into what we have today. Okay, so today we'll be talking about something that's going to be very, very mind blowing. You're going to be hearing things that you didn't know matter so much, and I want you to internalize them. You may not believe them immediately, okay, but as you move through life, you'll be able to see them clearly the way I'm seeing it right now. So I'm going to be communicating my thoughts, like not just my thoughts, something that has been researched and it has actually worked for so many. And I believe it's going to work for you if you pay close attention. So if you don't have your pen, I want you to pick up your pen right now. If you are not hearing me properly, you can identify in the comment section. I can see people typing at the comment section. So now, how do you reduce high cholesterol? How do you normalize your high cholesterol that is high? I want you to bring out your lab results where they wrote the cholesterol that you have where you are diagnosed of high cholesterol. Bring it out because we're going to be discussing that your results in this very live presentation. Okay, so now let's begin with what is high cholesterol. High cholesterol actually happen like, okay, let's start with what is cholesterol before we talk about high cholesterol, because for something to be high, that means there is something. Okay, cholesterol is nothing, is not a bad thing. Okay, just like everybody has blood, everybody has cholesterol. So if you're a living being and you have blood running in your system, you also have cholesterol. So where the problem lies is when you have high cholesterol. So now we're going to be looking at this cholesterol. What is it? Cholesterol looks like, how many of us have seen fat? Okay, cholesterol looks like something like fat, something like paste. Okay, so and the body actually needs this cholesterol to be able to insulate the body, to be able to form certain hormones, and to also form certain metabolic processes that is actually needed for the body to actually work well. Okay, so now where the problem lies is when the cholesterol becomes so high that it now starts impeding the normal function of the body. It now start causing problem in the body. So before we go forward, I want to also mention something that is very striking. High cholesterol is one of the sicknesses identified as silent killers. Meaning to say that someone may actually have high cholesterol without knowing, okay, until the high cholesterol begin to cause problem for that person. I used to tell people, by the time you start having the signs and symptoms that is attached to, that is linked to high cholesterol, it means that something serious is happening to you already. It means that you're in the danger zone. Let me put it that way. Okay, by the time you start experiencing the signs and symptoms, it means that you are in the danger zone. But that not to worry. If you're listening to this program this evening, it means that will I say God actually loves you and wants to save you. Okay, because I'm going to redirect your path in this very presentation. So we've been able to establish that we have what cholesterol is and what and that cholesterol is actually a normal phenomenon in the body. Now, we have two types of cholesterol. We have the good cholesterol and we have the bad cholesterol. Okay, so now I'm going to break it down because in your lab result that you're holding, you're not going to see good cholesterol, you're not going to see bad cholesterol. What you're going to be seeing is low density lipoproteins and high density lipoproteins. So which of them is the good cholesterol, which of them is the bad cholesterol? The low density lipoproteins are the ones known as the what? The bad cholesterol. Okay, while the high density lipoproteins is the one known as the good cholesterol. So when you go to test and you discover that your low density lipoproteins, the bad cholesterol is high, that is when it calls for concern. So we also have total cholesterol level, the combination of most of them, which is the one that actually gives us what we have as our cholesterol level test. Okay, and we're going to be discussing your result, don't worry. So we have the good cholesterol, we have the bad cholesterol. The bad cholesterol is the one that causes problem for us. Okay, the bad cholesterol is the one that causes heart attack. Okay, it's one that actually goes into the blood, causes blockage. The one we call arterial clog arteries. Okay, it can also cause the thinning of the blood vessel atherosclerosis that can actually lead to increase in blood pressure and all the things that you know that high cholesterol level can cause. So now this is how high cholesterol build up. The truth is that we are created with the right amount of cholesterol that should be in our body. But along the line, things went haywire. Things went the way they are not supposed to go. So when that happened, that is when we now begin to have high cholesterol. And the main thing started from when, from our upbringing, we were told one thing, and that is a major mistake. We were told that we need to be eating 3 square meal. 3 square meal. I want you to know that 3 square meal is actually one of the problems that we are having today in most of the health conditions people are having today spans off from 3 square meal. Now, let's look at it critically. Is 3 really a square? Okay, this is thought provoking for those of us hearing it for the first time. Is 3 really a square? When you talk about square, you talk about 4, right? I don't know if I'm correct. Okay, those of us who did sciences or the engineers in the house can actually help me identify my angles. We have triangle, which is 3 angles. Then we have 3 square meal. So what made 3 square? So these are the lies that was sold to us that we need to eat 3 times a day. And then people started living that life, and it was a kind of it started entailing affecting our health. If you look back to our forefathers, okay, I'm just trying to establish how did we come here? That is what I'm trying to explain. If you look at our forefathers, they are mostly farmers, some fishermen, or all the rest of them. So most of the time, they don't eat at home in the morning. When they wake up, they carry everybody, all the members of their household. Let's go to farm. Everybody moves out. They carry their water, they carry their food, they carry things. All of them go to the farm. And there in the farm, after they have worked for some time, that is where they now sit down, bring out the food they have, and eat. After eating, after they continue the farm work, they come back to the house. When they come back to the house, they prepare dinner, and everybody sits down and eats dinner together. And that was it. I don't want to talk about how fresh their food was in those days, but I want to give us the mindset that the kind of food, the kind of eating pattern that they had, they never did anything called breakfast. Our problem this day is that we want to eat 3 square meals. If you're not eating 3 times a day, people look at you that you're suffering. People look at you that you are having one issue or the other. For you that is battling with high cholesterol level, no matter the drugs you're taking, no matter the supplements you're taking, if you do not get it right with diet, you will have serious problem. You may have serious problem controlling your cholesterol level. In fact, it will be one of the major reasons why you have been taking drugs for 6 years. I've seen someone who have taken drugs for 6 years and nothing happened. The truth is that after taking drugs for 6 years and nothing happened, when they came to my class, just the way you're attending like this, because we're going to be having a program, okay? We're going to be having a program after this presentation. So that program is going to be for selected people, okay? So we usually have 20 persons per month for this program. But because of this is an extended version of our program, we're going to be looking at having 40 persons. So it's going to be a one-on-one program. So but we're going to be talking about that towards the end of our presentation. So now we're saying that we're talking about diet. So people eat more than their body requires. So people eat more than their body requires. People eat more than their energy needs. Your body needs energy to be able to work, do certain things. But we now eat more than our body requires. And by the time we eat more than our body requires, there is problem. Problem starts coming. So those energy that was not used, those calories that was not used, is converted to fats, converted to cholesterol. So when it is converted, you don't have the, what they call it, you don't have control over where the cholesterol builds up. Some people, it can go under their skin, some it can go into their blood vessels and begin to move, begin to penetrate. Before you know it, this person will be diagnosed, this person will be having high cholesterol, and we don't know. The person will have high cholesterol and we don't know. So a lot of persons listening to me now claiming that they don't have high cholesterol level. If you go for a check right now, you'll be surprised that your cholesterol level is actually high. A lot of people die of heart attack, not because of anything, but because of high cholesterol level. They don't know that their cholesterol level is high. They are having clogged artery without knowing. They are having symptoms they feel is normal, or they must have missed it with one thing or the other. Okay, they are having chest pain. They feel it's because of ulcer. Some persons may be treating gallbladder stone. You know, a lot of things. That is why I tell you, if you're having any medical condition, it is better you get a coach. A health coach is different from a doctor. Okay, a health coach is different from a doctor. A coach is someone that will be with you, that will be on you and ensure that you get better. A doctor can also be a coach, don't get me wrong. But there's something called a health coach that's going to formulate something that fits you. Okay, that artemether works for malaria doesn't mean that once a doctor that knows it prescribes it for this person, prescribe it for that person, there are people that it wouldn't work for. That is work for Mr. A doesn't mean it will work for Mr. B. So that is why a coach comes in. While you're taking those things, we now come like, what and what do you need to do as a person that is going to help you to help this thing you're taking work faster and work better. So that is what I'm doing. Okay, the drugs your doctors are giving you, they are okay, but how do you get fast relief? How do you ensure that you are properly monitored? In fact, our program lasts for 6 weeks. So that 6 weeks, after the end of the 6 weeks, you're expected to go back for to check your cholesterol level. Okay, and if it fails, if that if your cholesterol level didn't come down after 6 weeks, you start the program again. I don't know if you're getting me. But the truth is that more than 95% of persons who did our program, they okay, sorry Rita, I'll be louder right now. Okay, more than 95% of people who used our program, they had um, improvement in their cholesterol test. We've had people who have as high as 308 cholesterol, 380 milligram per DL, that crashed to 140 within 6 weeks. Okay, we've had amazing testimonies, amazing testimonies, amazing testimonies. We've had amazing testimonies in this very meeting. So I'm encouraging everyone listening to me to make sure that you're part of this program that you're going to be starting at the end. So we're going to be looking at 40 persons because we are having an extended program. Normally it's just for 20 persons. We're looking at 40 persons. It's going to be one-on-one. So you're not going to be added to any special group. It's going to be me and you. We're going to be doing that. So we're talking about how cholesterol build up. We actually eat more than we require, and the cholesterol moves to different parts of the body and start building up. So one of the things that we now call fasting shouldn't even be called fasting. It should be our way of life. But somebody somewhere came and distorted it. Like I said, our grandparents, they eat, there was something like breakfast. They carry everything and go to the farm and eat in the farm after they have worked for some time. Then come back home and eat in the night. That is 2 times a day. So for them to fast means that they won't eat the whole day, or they won't eat for 2 days. So for us skipping breakfast, we feel like we have done something wrong. When you wake up in the morning, the thing that is very important for you to do is to drink water. In fact, this week I did a video about how to drink water. A lot of us drink water, but we don't know how to drink water. In fact, we're not drinking water properly. So if you are in the class of people who are not drinking water properly, I'm encouraging you to go to this YouTube channel where you are right now. You will see a video I did. I think that should be the last video before this, where I talked about how to drink water properly. So what they do is that very early in the morning when they wake up, they drink water and they move. They still carry this water to the farm and they trek a distance. Are you wondering why those people lived longer than we are doing these days? Someone said, kidney failure was not there during the time of our fathers. High blood pressure was not there during the time of our fathers. This one was not there. Are you living the kind of life that your grandparents lived? Everything now is artificial. I don't want to talk about that. Everything now is frying. Frying predisposes you to developing high cholesterol level. Okay, there's something that was also missed. See, when you fast, when you skip this, when you give your body time to metabolize the food that you've eaten, it's actually a healing process. So I said, these our parents, they walk to the farm. All of them. This one will carry hoe. This one will carry cutlass. This one will carry in fact, when bicycle came, they will now start carrying their bicycle. They will start carrying their bicycle and they will be moving into the very long distance. They will cross, some of them cross will I say 7 seas? Some of them will cross a lot of hills and the rest of them. Some people, like from my place that we have, I'm from Enugu, so our place is very, very hilly. They will cross hills. I'm also partly from Ohofia, so that means my people from Ohofia too, they need to climb on the hills. So you discover like someone came to Ohofia, I think for traditional retirement one of the years, and he discovered that old men Discover that they have more old men in this place, and they're like, how, why, how? But in the town, you see people dying. For anybody that managed to cross 45 will be thanking God. Anybody that get to 60 is an old man. Meanwhile, in the villages, people are clocking 75. Our grandparents lived to 95, 100, 120. I stay in Abakaliki, so if I'm telling you something, I'm telling you something from, like, I've seen old men, people here, they buried somebody 130 years. So what's happening in Lagos? What's happening in Abuja? What's happening in Port Harcourt? What's happening in these big cities? People no longer have time for exercise. Please don't tell me that you go to gym. Don't tell me that you go to gym. People don't spend time to actually do the things that they do in gym. In fact, people who attend my program, I usually tell them to exercise at home. Some of them who actually go to gym before, by the time they start exercising at home, they gain more in their health than when they were going to gym. What are you going to gym to do? To snap pictures, to socialize, and all the rest of them? Missing the kind of thing that you need to be doing to actually get results. Am I communicating? Okay, when you're exercising, because that brings us to physical activity. When you're exercising, you are supposed to have exercised to a point for you to begin to burn fat, for you to begin to burn cholesterol, for you to begin to make impact in your health. But you see in gym, by the time you do like 2 seconds, 2 minutes, 3 minutes, someone comes to distract you. You're taking pictures, you're taking selfies, that you're resting, you start again. The whole thing starts afresh. By the time you build up, something distracts you again. So those distractions, you may be going to gym and you're not getting the effect. But if you're able to concentrate in the place you're doing your gym, it's okay. Okay? So that is why in our program we have exercises and we have different time for each exercise that you're supposed to do it and get the maximum result. That is why it is very hard for someone who have used our program and the person will not crash his or her cholesterol level. Very, very important. Very, very important. It is very difficult for you to see someone that has used our treatment modalities and the blood cholesterol level didn't crash. So apart from that, another problem we start having about our health that also contributes to building of high cholesterol is the way we socialize, especially guys. In fact, I'm going to come to a place where I'll talk about age and sex, how cholesterol and all the rest of them plays out. A lot of guys, how do they socialize? They socialize with alcohol. We've seen guys that they can, at a go, they can pull out 3 crates, 4 crates, one person. I'm not talking about 2 persons. So, and this thing they do it day in, day out. I know of someone who every evening when they go to work and come back, in fact they don't come back home straight. They go to beer parlor and they do 7 crates. They do 2 crates. And when you ask them, they say something must kill a man. The truth is that you've not gone to hospital, so that's why you believe that something must kill a man. One sickness can drain your bank account. One sickness can drain all you have worked for. One sickness can ruin it all for you. That is why you need to be very, very careful. That is why you need to be very, very mindful of what you do to your health. Because when health is lost, everything is lost. You can lose money, you will get the money back. You can lose friends, you will get friends back. But when you lose your health, you may not be able to restore it to normal. I know what I'm telling you. Last year, December, I had a fractured I had a fracture that is called tibial plateau fracture. I did a surgery, a knee surgery. After the knee surgery, I want to tell you that till today, that knee is not the way it was before the fracture. So that same way is the way it goes for your health. When you lose it, it may get better, but it cannot be like before. Ask those who had kidney failure and they've done transplant. Yes, with your new kidney you can live a normal life, but there is nothing like the original kidney. Because if you have a new kidney, you got kidney transplant, you need to take post-transplant medication for life, and it is timed. This one you're taking your BP medication and you're missing it. It is not same for person who have kidney transplant. You have to keep to your time. This one you're treating high cholesterol is whenever you remember that you take your cholesterol medication. Don't be so for kidney transplant. You must keep to your time. And if you miss the time, a second, rejection can happen. So that is why I'm saying you need to take your health very, very serious. Cholesterol triggers, alcohol triggers cholesterol. All of them goes high. Then another thing that actually triggers cholesterol is stress. So how do you differentiate stress and exercise? So by the time you stay at work from morning till evening, you think that it is enough to burn your cholesterol level. See, your body has an inbuilt mechanism that actually understands when you're stressed and when you're exercising. Okay, your body has an inbuilt system that understands it. When you're running around, okay, my mom said she can't stay one place. She's a businesswoman. That if you've been trying to stop her from doing business and all the rest of them going out, she said no, that she needs to go out. So her mindset is that the more she goes out to do business, that it's going to help her control cholesterol so that all these health issues won't come out. But the truth is that the body doesn't see that as exercise. It is different from exercise. So by the time you're not exercising, when you're not exercising, you're stressing. Stress triggers the cholesterol level to come up. I don't know if I've said what you want to hear. So, but the truth is that if you're writing down or you're taking points of what I'm talking about, you would have actually realized there are places that we have missed it that is causing our cholesterol level to build up. And one of those places is what we've talked about, our eating habits. If you're going home today and you didn't get anything from what we've discussed today, just know that 3 square meal is a scam and is an attacker of your health. Then number 2 is that we are eating more than our body requires. Cut down on your diet. And number 3 is physical activity. We don't exercise. Then number 4 is cholesterol, alcohol. So now, then we'll also talk about stress. For those who feel that stress is a form of exercise. Stress is not a form of exercise. Are we together? All right. So now let's look at non-lifestyle related factors. So now all the things we've talked about, they are lifestyle related factors. So now let's look at the things that are not lifestyle related. So number 1 is that to some people, high cholesterol level may be triggered by certain genetic transmissions. Okay, so now it's also age. As we grow older, we have the propensity, or we are predisposed to having high cholesterol level. Okay, this is because the more we grow older, the more we feel that, the more we become inactive. Okay, the way we were very active when we were small, when we were kids, is not the same way you'll be active at 18. And the way you were active at 18 is not the same way you'll be active at 35. And the same way you're active at 35 is not going to be the same way you'll be active at 50. So the more you grow, the more your energy needs increases or reduces, and the more you actually get predisposed to these conditions. So the higher the age, the more you're more predisposed to high cholesterol. This means that as adults, we should take it as a point of duty to check our cholesterol level. If you're in Abakaliki, you can give me a call. You can come to my office. We'll check your cholesterol level. Very, very important. Very, very accurate results so that you know what you're doing. So it's something that you should at least do once in a year. At least once in a year. Especially if you have medical conditions that I'll be discussing later. Then for women, when as a woman, by the time you cross menopause, your body opens up for cholesterol to build up because you have a lot of issues. You'll be looking at my leg, my this, my that. Cholesterol will be improving, will be climbing, and all the hormonal changes that are associated with menopause and postmenopausal women. There are some medical conditions. If you have some medical conditions, it can also predispose you to developing high cholesterol level. One of those medical conditions, let's look at them: diabetes. So, how many of us are diabetic here? Diabetic here? If you're diabetic here, can you type in the comment section, "I'm diabetic"? Okay, being diabetic is also a predisposing factor to developing high cholesterol. Did it shock you? Then when you have chronic kidney disease, there's something called chronic kidney disease. Okay, in a video, I'll actually be discussing that, but since we are here together, I want us to get all the information that we need to get. Number one is that we're talking about lifestyle. Okay, we're talking about kidney disease. Some will tell me I'm having kidney disease. I'm having kidney disease. Kidney disease is a broad term that a lot of things a lot of things are involved in it. Kidney disease is an umbrella term that guides what do you call it? That guides different kinds of kidney disease. We have kidney cysts. We have pyelonephritis. We have kidney stone. We have chronic kidney disease. We have acute kidney injury, and a lot of them. So under these different kind of kidney disease, that's where we have CKD. CKD is chronic kidney disease. And in chronic kidney disease, we have stages. We have stage 1, we have stage 2, we have stage 3, we have stage 4, and we have stage 5. In fact, this stage 5 is the one that is actually